Well, there's an increase right now of COVID cases in Illinois, and those numbers could climb even higher in the new year. News 3's Danny Vai joins us live in studio with more. And Danny, doctors fear this could further strain staff at local hospitals.
Yeah, Julie, that's right. And healthcare workers are operating under state guidance that Delta is the prominent strain in our area, not Omicron. That's what Dr. Jeff Ripperda from Shawnee Healthcare told me today. Now, yesterday, Dr. Ripperda's practice alone recorded about 30 to 40 cases, but they couldn't verify which had Omicron or Delta. But Julie, one of their biggest worries is not having enough staff for non-COVID patients. Dr. Ripperda says they've had to push back elective surgeries even before the pandemic. So now they're working with an extended backlog, and they've had to send critical care patients to hospitals in Evansville, Indiana, for example, because they had an open bed. Dr. Ripperda says it's a long game of catch up with potentially dire consequences.
Everybody's going to have a story about not being able to provide adequate care to somebody because we just didn't have the resources. I hate having to do that. You know, I didn't devote years of my life of training, hours of practice to try to provide suboptimal medical care. I like being able to get people the care they need when they need it.
Now, Dr. Ripperda expects a surge in cases in the next 2 months. He doesn't believe we've seen the peak of this surge. He expects a surge similar to the one we saw over the summer and last winter. And Dr. Ripperda says symptoms are similar between Delta and Omicron, so if you do have a rough cough or sinus infection symptoms, Dr. Ripperda suggests getting your test immediately, or even better, taking the vaccine.